What's up, y'all? Welcome to the BirthFit podcast. I'm Dr. Lindsey Matthews Cantu. I am your BirthFit podcast host, your founder, CEO, all the things right now. I wear all the hats, except I do have an awesome admin team that helps support me. Anyways, we have an episode we got to talk about some stuff in here. This is episode number 268. This is not easy stuff to talk about, but it's necessary stuff. And where the heck did my notes go? We're talking about bleeding in the first trimester. And oh, I know a few podcasts ago, I shared about miscarriage in the first try. Or let me find that episode so you can just revert back to it if you need. This episode is really great. Yes, first trimester miscarriage facts and options. This is episode 256. Um, and I wanted to do an episode for the in between because I've had a lot of comments and questions from women about, okay, but like, what do I do? I just turned 11 weeks. Started bleeding. I got some bleeding when I wipe. It's not much. Um, I've got some brown blood, that sort of deal. So this is for that like gray area in between you realizing that pregnancy is going to be successful or the pregnancy results in a loss. And that's just what it is, y'all. There's no way to sugarcoat it. You know, as an acupuncturist, I had a great acupuncturist during my pregnancy, and I'll share with you, I started experiencing bleeding, and it was the day after I did some big inversion trainings for myself, and it wasn't training that was out of the ordinary for me. It was just, the next day my body was speaking to me, my baby was speaking to me, and I whenever I wiped, there was some brown blood there, there was a little bit of red blood, and based on my symptoms and consulting with my acupuncturist and my midwife, we determined it was a subchorionic hematoma. And that is one of the more common causes of first trimester bleeding, and it's where blood can be red or brown and may come in waves. And there's a collection of blood between the gestational sac and the uterine wall. So what I'm guessing is when I did those inversions, it kind of shook things up. Um, Many resolve on their own with a little rest and support. And that's exactly what I did. For 2 weeks, I kind of chilled the F out, um, like less than my normal routine. And I continued with acupuncture twice a week. I continued with my chiropractic adjustments twice a week. I sat in stillness. Um, I sat in a lot of prayer. And I really think it was my body, my baby, and my God telling me, hey, you're in a season of life right now where you need to slow down a lot more than you already have. You need to embrace surrender. You need to soften. There's so much beautiful feminine energy happening. Lean into that. Lean into faith. I really think it was God calling me to just be different, to be in present time consciousness. And we talk about this a lot in the chiropractic space when you're about to adjust somebody to be in present time consciousness. But that's what that chapter, that moment called me into with this pregnancy. And I'm so glad it did. The other thing I did castor oil packs 2 to 3 times a day for 20 to 30 minutes for about 2 weeks. Um, Pelvic rest, basically no sex. I didn't really do any lower body exercises. I walked. Um, Walking didn't seem to increase my bleeding or not. It was just kind of Like it really was wave-like as kind of the definition of subchorionic hematoma says. So this episode is about that gray space, that unknown space, like you're sitting in right now. And if that's you and you're listening to this, first of all, I want you to breathe. Whew. Let something go. Let's do it again. Breathe in and long audible exhale. Ah. You found this resource, this podcast, maybe you found our blog, our website, whatever. And that means you're doing exactly what a good mother does. You're seeking information and support. And you are a vessel. You are a vessel for this baby spirit that has chosen you, no matter how long their journey is. And that is why we are called into this present time consciousness. Um, And let's just start talking about it. About 20 to 25% of pregnant women will experience some sort of bleeding in the first trimester, and the majority go on to have healthy pregnancies and birth and motherhood, children, etc. Um, so just keep that in mind. Let's not go. You're in the gray area. You're in, as Dr. Seuss says, you're in the waiting room. It's not a fun place to be. Sometimes it's a necessary place. It's a place where God builds you and molds you a little bit. Um, and we're going to talk about some facts here. Um, what I'm about to share is not a substitute for care. It's an honest, holistic look at what a first trimester bleed can mean, and maybe how to support your body and your baby and your nervous system while you figure out the next steps. All right, so what to do when you get bleeding? Not all bleeding is the same. The color, the amount, and the accompanying symptoms are all important clues. So take a breath and do an honest inventory. Um, if you can't do an honest inventory for yourself, maybe grab your partner, your husband, a best girlfriend, your doula, maybe talk to your midwife. Um, if you have a provider on that you share, I'm hesitant to say provider because they all go medical, but you might have a girlfriend or something that can do an honest inventory. Pink or light spotting, especially early on, can be due to implantation or cervical irritation. Bright red, that's active, fresh bleeding. Um, And that's probably where you might want to lean to reach out to your provider, whether it be a midwife or a doctor. Brown or dark, that usually is older blood, less urgent, but still worth reporting. Gray or tissue-like requires immediate evaluation. The amount, right? Like that's if there's spotting versus flow, like filling a pad, those are two different things. Like when you wipe versus having to wear a pad. If you are bleeding heavily, like you are soaking a pad in an hour, go to the ER. Um, if you have cramping, mild period-like cramping with light bleeding is common and often benign. Severe one-sided pain can indicate an ectopic pregnancy. That's ER type of status. Um, Increasing cramping with heavy bleeding, that requires care. If that's what you choose, yeah, I would say that. If care is if a provider, because I know some of you listening are free birthers, um, just something to keep in mind. If there's any dizziness, fainting, shoulder pain, um, like pain out of the ordinary, like that would be emergency type of situation, I would think. If there's fever combined with bleeding, that go like in my mind that goes to infection. Um, if you've had any recent intercourse or pelvic exam or vigorous physical activity, that's something to make note of, especially, if there's blood when you wipe the next day or next time. So get that inventory going. If you're like, should I go to the ER? Go to the ER if there's heavy bleeding, soaking a pad in less than 1 hour, severe abdominal pain, one-sided pelvic pain, dizziness, fainting, shoulder pain. If you're passing any grayish tissue-like material, and if there's a legit fever alongside any of these other symptoms. So, possible causes. If there's bleeding between weeks 4 and 15, um, most are not a sign that something is irreversibly wrong. But, here's some of the causes. Implantation bleeding, we talked about that. This is usually around weeks 4 to 5, and that's when the fertilized egg embeds into the uterine lining. Typically, it's very light or light brown, light pink or light brown, some spotting, and only lasts maybe a day or two. It's often mistaken for a very light period. The second one is subchorionic hematoma. Like I shared in my story in the beginning, this is a collection of blood between the gestational sac and the uterine wall. Um, the blood is usually reddish and brown and may come in waves. Cervical sensitivity, cervical irritation. The cervix is highly vascular in pregnancy and literally grows more blood vessels to support the pregnancy. So, any contact with the cervix, like intercourse or pelvic exam, or even, let's say, recent, like legit vigorous bowel movement, can cause light spotting. Bright red blood after intercourse or a vaginal exam is often cervical in origin and not coming from the baby. Just something to make note of. And usually that's like right after. A cervical polyp, that's a benign growth on the cervix that becomes more prone to bleeding during pregnancy due to increased blood flow. Um, it's usually harmless and it's usually detected on a vaginal exam. You might know you have this going into pregnancy. Um, Threatened miscarriage. This is the term providers use when there's bleeding, but the cervix remains closed and the pregnancy is still viable on an ultrasound. This is a diagnosis of watchful waiting and not a certainty of loss. Many threatened miscarriages do not progress to actual miscarriage. Um, and then pregnancy loss, miscarriage. This is about 10 to 20% of known pregnancies end in miscarriage, most in the first trimester. And bleeding that progresses to cramping, heavy flow, passing of tissue may indicate pregnancy loss. Genetic factors are usually the majority of the reason for the first trimester loss. A prior loss does not mean the current pregnancy is at greater risk, but it can mean your emotional response is layered and deserves acknowledgement, right? Like it can get pretty heavy. Um, I know that was the case for me because I experienced a miscarriage 2 years before. And when I started bleeding, the blood, like the brown blood was different. Um, Fear, like just snuck in. And I think that's why God said, no, no, you're not going to let fear lead this. Um, so anyways, ectopic pregnancy, this is a pregnancy where it's implanted outside of the uterus, usually in a fallopian tube. This is, I would say it's a medical emergency. This is where you usually have one-sided pelvic pain, shoulder pain, dizziness, some light vaginal bleeding. You're proud like me medical intervention is probably necessary. So you free birthers might want to just make note of that. Um, and I love free birth, y'all. But we live in a time where we have access to medical emergency situations and support. Molar pregnancy. This is a rare condition in which abnormal tissue grows in the uterus and may be accompanied by nausea, grape-like tissue, and very high HCG levels. and this is usually diagnosed by an ultrasound and or blood work. And then physical activity or exertion, myself, high impact exercise, inversions, heavy lifting, or bearing down movements can temporarily increase the intra-abdominal pressure and trigger spotting, especially in the presence of a subchorionic hematoma and cervical sensitivity. This does not mean the movement caused harm. It means the body is simply communicating to you. So if you seek care, next step would be, okay, if you seek care from a midwife, OB, or go to the ER with first trimester bleeding, here's what you may encounter. And I'm sharing this so you can make informed decisions, not because I recommend all of these interventions, or that I would choose them myself. Just know your options, ask questions, and advocate for yourself. If you go to an OB or an ER, or a midwife, depending on where she practices, they might recommend a transvaginal or abdominal ultrasound to confirm a fetal heartbeat and the location of pregnancy, and to check for a hematoma or other structural findings. When I started bleeding, they did suggest an ultrasound, but that is not something we chose to do. We did not do any ultrasounds during my pregnancy. Um, they might recommend a blood draw to check HCG levels and sometimes repeat that at 48 hours later. They might want to check blood type and RH factor. Um, if you're with a provider, they might offer a RhoGAM injection if you're RH negative. This is something to research heavily and discuss before deciding. Personally, I'm against RhoGAM injection. I don't see the efficacy of it, and I'll do a podcast on it in the future. Um, it's similar to in my thoughts of the GBS conversation. So it's a very personal decision. And one of the things that contributed to my decision as somebody being RH negative was like, you don't know where that blood's coming from. And I don't know, who's been injected with the COVID mRNA vaccine or not. And I don't want that in my body. Um, okay, your provider may want to do a pelvic exam to assess the cervix, and then your provider may want to discuss any activity modification, pelvic rest, monitoring protocols, etc. Remember, you are allowed to ask questions. You're allowed to ask what was seen, what the measurements mean, what the protocol plan is. If you feel dismissed, ask again. You're not being difficult. You're being your baby's first advocate, and you're advocating for yourself. So during this waiting space, this unknown space, you've got to rest. Um, Here, I'll share what I did, as I mentioned earlier. Take what resonates with you and leave what doesn't, honestly. You know your body, and the pregnancy will stick or it will not stick. And that's just as matter of fact as I can be. As we're transitioning, I'll just say this real quick. As we're transitioning from the first trimester to the second trimester, it's such an interesting pivotal time because our bodies literally shift from, excuse me, prioritizing our health to prioritizing baby's health. And I think if you want to get kind of woo-woo with me, like that's this baby, this fetus needs to be strong enough, needs to have some sort of baseline level of fitness, needs to have this innate intelligence, this vitality built up um, to transition into the second trimester. Um, yeah, it's so interesting. Anyways, so rest. This is not a time to push through. I chose not to push through. Remember pelvic rest, no intercourse, no tampons. Try not to put things in your yoni, in your vagina. Um, in this waiting space, I reduced my activity load. Um, this is where I watched, some good TV, um, along with read books, journaled, sat in prayer, sat in nature a lot. Hydration and nourishment is key. Don't neglect yourself during this time. Bone broth, meat stock, coconut water, all of that is still a priority. Eat warm, eat easy to digest foods. Don't restrict yourself. Don't count your calories. Don't do that. Um, you need to have protein, quality animal products. It's it's not a time to like just forget everything. Um, some providers, and you might want to check with your provider, some of their blood tests may be to check progesterone levels, and they may recommend progesterone support if levels are a little low. Uh, I'm literally the next podcast is going to be about topical progesterone. So just tune into that. Castor oil packs. This has long been used in naturopathic and traditional medicine to support circulation and reduce inflammation and calm tissue. I think that's why my acupuncturist recommended it. And I just use this 30 minutes, 2 to 3 times a day over my uterus. And I would put a little, like a tablespoon or two on a piece of flannel, put that on my lower abdomen, then wrap that up. Um, Herbs and supports, you might want to check with your provider, your midwife, whoever on this. Vitax may support progesterone balance in early pregnancy, and that's usually stopped by weeks 12. Red raspberry leaf, that's the gentle uterine tonic. Many midwives will recommend this from second trimester on. Magnesium helps to relax the muscles and sleep. Vitamin C is great. It also helps with boosting progesterone. And, if you're trying for nutrient density, blood building, liver, spleen support, those kind of things. Be sure to love on your nervous system. If you're not seeing a nervous system-based chiropractor, work on breathing, box breathing, long exhales, diaphragm breathing for like 5 minutes a day minimum. That's going to be key. Limit doom scrolling and searching for symptoms because then the algorithm will just put that for you to see. Um, Ask for physical touch from your partner. That goes a long way, even if it's rubbing your feet, holding your hand, brushing your hair, whatever. Um, a weighted blanket, familiar music, a podcast that you love, something. Call someone that you can just be yourself with and not panic. Uh, and I want to leave you with this prayer because, as I said, um, I was called into a deeper, deeper journey with my faith. And for many women, faith is the first place they turn when fear arrives. Whether you have a formal prayer practice, a relationship with God, the universe, or something bigger, this is a moment to lean in, not away. And in Isaiah 41:10, do not fear, I am with you. Fear is not the truth. I want to share this other one with you. Jeremiah 29:11, for I know the plans I have for you, plans to give you a future and hope. Lord, I am scared. I do not know what is happening inside this body you have made, but you do. I lay this baby down before you. Not because I'm giving up, but because I trust that your hands are bigger than my fear. Give me peace that surpasses understanding. Give me clarity about what to do next. And let this little life know already that they are wanted, they are loved, and they are not alone. All right, y'all. That's it for this episode. If you need anything, please email us info@birthfit.com. I'm sending you love. while you are in this waiting space. And know that if the pregnancy progresses to a loss, check out episode 256 and be sure to go to our digital resources and download the PDF for infant loss. It has lots of info there. And I'm sending you so much love. I know how you feel. It's not a fun time. It might be a necessary time, but ask God, ask your baby what they're communicating to you. Sit in stillness, present time consciousness. All right. Love y'all.